Good morning. Today we are going to discuss about the topic finance dentistry. Finance dentistry. We are going to cover about introduction, structure of dental practice, private dental practice, open and closed panels, managed care, hospital dentistry, insurance and dental care, classification of payment plans, private fee for service, private third-party payment plan, post-payment plans. Coming to introduction, in most of the developed and developing countries, cost of the healthcare services are rising sharply. Dentists are often puzzled when patients and public complain of high cost of dental care. From time immemorial, the of healthcare entry into third-party dental care is now a major and still evolving part of dental practice. Structure of dental practice. Primary goal of dental practice is to promote oral health of the public, at the same time preserving the autonomy and economic well-being of the profession. This is achieved by coordination between the structure of the system, that is organizational arrangement by which patients and provider meet, the means by which the care is paid for, the supply of various types of healthcare professional. Next, private dental practice. Traditionally, dental care is delivered by independent private practitioners. Adaptability in a rapidly changing world is a major strength of private practice, an attribute that ensures private practice will endure the challenges of changing times. There are many advantages in private practice. Private practice can also be a solo organ. Solo practice means it refers to work in a practice with no other dentist. It's most commonly used. Group practice, it often refers to practice with at least one with other dentists, according to IDA. Generally, small, consisting of two dentists. Next, advantages in private dental practice. Flexibility in terms of duration of work, fees, and so on. Increase in total productivity. Provides free choice for the practitioner as well as for the patients. Next, open closed panels. According to American Dental Association, it's defined as closed panels as existing when patients eligible to receive benefits can receive them only if services are provided by the dentist who have signed an agreement with the benefit plan. For instance, the practice is set up by an employer or union for the treatment of employees and their dependents by salaried dentist. In an open panel, any licensed dentist may elect to work with the corresponding beneficiaries. The dentist may accept or refuse any beneficiary. Next, managed care. As per Health Insurance Association of America, managed care is defined as a system that integrates the financing and delivery of appropriate services with certain providers to furnish a comprehensive set of healthcare services to members. Explicit criteria for the selection of healthcare providers, formal programs for ongoing quality assurance and utilization review, significant financial incentives for members to use providers, procedures associated with the plan. The most common forms of managed care are health maintenance organization, preferred provider organization. Now coming to health maintenance organizations, it provides an acceptable alternative to provide to private practice system and help restrain the cost of care. It was defined in 1973 Act as a legal entity which provides a prescribed range of health services to each individual who has enrolled in the organization in return for a prepaid, fixed and uniform payment. Health maintenance organization having 5 essential elements are the managing organization, a delivery system, an enrolled population, a benefit package, a system of financing and prepayment. Next, dental person HMOs. In staff model, dentists, dental hygienists, dental assistants, and salaries employees of HMOs are included. In group model, HMO contact directly with a group practice, partnership, or cooperation for provision of dental services. Independent Practice Association. It is an association of independent dentists that develops its own management and physical structure for the treatment of patients enrolled in HMO. IPA acts as a link between HMO and providers. Next one is capitated network or direct contract model. Similar to IPA, except that HMO contracts directly with the individual provider for provision of services, which is most common. Next, preferred profit organization. It involves contract between insurance companies and number of practitioners who agree to provide specific services for fees that are lower than average for the area. Now coming to hospital dentistry, situations requiring general anesthesia, oral surgery for removal of tumors or corrections of lip or palate, prosthetic treatment for victims of trauma or burns involving head and neck region for patients with systemic disease. Next, insurance and dental care. After World War II, medical insurance was growing rapidly. Dental care was considered uninsurable by carriers. To be insurable, the risk must be precisely definable of sufficient magnitude that if it occurs, it constitutes a major loss, infrequent, beyond the control of the individual. The only category of dental care insurable is oral surgical procedures and some restorative procedures that follow in the wake of accident. Next, insurance helps in several ways to provide dental care, such as having the patients pay a share of the cost, including waiting periods after enrollment before benefits become payable, using pre-authorization and annual expenditure limits, limiting the range of services available. Now coming to classification of payment plans, classified into private fees fee for service, post payment plan, private third party payment plan, salary, public programs. In private third party payment plan, commercial insurance companies, non-profit health and service corporation, and prepaid food plans. Private fee for service. Private fee for service is a two-party arrangement system in the traditional form of reimbursement for dental services in almost all countries. Advantages of this: flexible, culturally acceptable, simple in administration. Disadvantages are some patients cannot afford dental care offered, hence these persons will be unable to receive dental care if private fee for service are the only financing mechanism for dental care. Next one is private third party prepayment plan. In this system, the patient and the dentist are the first and second parties. The administrator of the finances is the third party. Dentist receives payment by an agency rather than that by the patient. Also called the carrier, insurer, underwriter, or administrative agents. The term public financing of care is used when the government acts as a third party. Next, reimbursement of dentists in third party plans. The major forms of third party reimbursement in use are usual, customary, and reasonable fee, table of allowances, fee schedules, and capitations. ADA definition of UCR fees are: usual fee means the fee that an individual dentist most frequently charges for a given dental services. Customary fee: the fee level is determined by the administrator of a dental benefit plan from actual submitted fees for a specific dental procedure to establish the maximum benefit payable under a given plan for a specific procedure. Next is reasonable fee. The fee charged by a dentist for a specific dental procedure that has been modified by the nature and severity of the condition being treated and by medical and dental complications or unusual circumstances. Next one is table of allowances. It defined as a list of covered services with an assigned amount that represents total obligation of the plan with respect to payment for such service. A fee schedule is defined as a list of charges established or agreed upon by dentists for specific dental services. Capitation. A capitation fee is defined as a fixed monthly or yearly payment paid by a carrier to a dentist in a closed panel based on the number of patients assigned to the dentist for treatment. Capitation fee is defined as a fixed monthly or yearly payment paid by a carrier to a dentist in a closed panel based on number of patients assigned to the dentist for treatment. Some of the commercial insurance companies were Travelers, Secura, Esocum, Hanover, Acuity, like this, etc. Commercial insurance plan, the carrier develops fee profile based on prevailing fees in a given area. The dentist are paid at that rate. Fee audits, post-treatment evaluations are less likely, while pre-authorization, annual expenditure limits, and monitoring of treatment patterns are conducted. Advantage, the payment is quicker and hassle-free. The fee audits and post-treatment of dental examinations are not conducted to assess the quality of dental care delivered. Disadvantages are they do not encourage utilization of professional services. In order to allow for profit margin, they need to charge higher premiums. Non-profit Health Service Corporation, Delta Dental Plan, is formerly known as Dental Service Corporation. Dental Service Corporation was born with the purpose of providing comprehensive dental care program for children up to 14 years age. A dental service corporation is a legally constituted not-for-profit organization incorporated on a state-by-state basis that negotiates and administers contracts for dental care. Characteristics of dental service corporation as per Mitchell and Hoggard are professional sponsorship, non-profit operations, participation permitted by all licensed dentists in the state, benefits provided on a service basis, freedom of choice for both patient and dentist. Reimbursement of dentist in Delta plans depends on whether a dentist is participating for dentist or not participating non-for dentist Delta. The participating dentist is one who has entered into a contractual agreement to provide care to eligible person. The conditions to be fulfilled by the participating dentist are filing of their usual and customary fee with Delta, acceptance of payment for their services at an agreed on percentile as payment in full, pre-audits by auditors from Delta, check the office records from time to time, post-treatment inspection of randomly chosen patients by other dentists, the withholding by Delta on the small amount of each payment, usually to build up insurance reserve. Thank you. These are the references.